Pain is something I really enjoy resolving for people. It's very gratifying. Whether it is a headache, whether it's chronic migraines, whether it's joint pain, back pain, nerve pain, abdominal pain. I think I've got them all. Pain is a sign that something else is wrong. That sign, that something else that is wrong may be just inflammation that's created by infections. It could be inflammation that's created by a poor diet, could be stress, could be blood sugar dysregulation, could be a lot of different things. I once had a dentist who his girlfriend had been trying to get him to see me for years, and finally he made an appointment. And I ran into him in the hallway when he was picking some supplements up a couple weeks after I had seen him. Anyway, what he said to me, the comment he made was, he said, I don't really get this. And I said, what do you mean? He said, well, my pain is gone. I'm a little confused. And I said, why? And he said, well, I don't understand how that works. And I said, well, when you give your body what it needs and you remove the things that shouldn't be there, that's what happens. Inflammation goes down. And in his case, his pain was gone. All of the joint pain that he'd had for years was gone in just a couple weeks. So this is not always the case, but a lot of the times that is what I find. And I've even had patients who've been told they have to have shoulder surgery or a knee replacement. And, within a few weeks, we're able to get them to a place where they realize that does not need to happen. I cannot fix bone on bone pain. If you have no cartilage, you're probably going to need either stem cell injection, which I do not do, or you're going to need a joint replacement. There are nerve pains that I have been able to resolve, trigeminal neuralgia and some other kinds of nerve pain that people are told they're not going to be able to get rid of. We use treatment. We have different cutting edge technologies, and we have treatment sessions for patients so that we can help resolve these things. I've been resolving chronic migraines for years. All different kinds of pains, abdominal pain, people have had, 24/7 for years, and we're able to clear it up fairly quickly. So what I want to drive home, though, is that when we resolve pain, because it happens a lot faster than people often think is possible, is that it doesn't mean things are healed necessarily. It means that the inflammation or the underlying thing that's causing the pain has lessened enough so that the pain signal doesn't need to be there. It doesn't mean that it doesn't take longer to heal. Like, true healing doesn't happen in 2 weeks, and it doesn't happen in a month. It can take, 3 months, 4 months, 5 months. That's why all of our programs typically are about 12 weeks. We want to have a good amount of time to seed in the healing so that you can, your body can really have a significant change. And so the way that we do this is through the programs that we have, where we incorporate dietary changes, we incorporate supplementation, we incorporate treatment sessions, we incorporate the information that I get from a detailed lab analysis. And so what you need to understand is that when we do all of these things together, we tend to get fairly quick results. And as I said before, it's very gratifying for me, but it's also exciting for patients, because a lot of the times when people have pain, they're told that they're just going to have to live with it unless they're using some sort of painkiller. And I did have a patient once who he had used so much ibuprofen over the previous 10 years that he actually ended up needing a kidney transplant because of it. So if you can solve pain in a way that actually makes you healthier, I think that's definitely the route. So if you have any questions, if you are concerned that if you schedule a first appointment and I may not be able to help you, schedule a discovery call first. We'll get on the phone and we can talk about what we're gonna do to help you and if you are a good fit.